morning, everyone. I would like to thank the organizer of the webinar for inviting me today to be with you. My name is Iman Hakim, and I am the Dean of the Mellon Unit Zuckerman College of Public Health at the University of Arizona. And I will give you a quick preview of the public health education in the United States of America. So my presentation will have an overview going about the definition of public health education in the United States, and then our own college, and we'll end with a very quick conclusion. So what is the definition of public health? As you might all know, it is the science and art of preventive disease, prolonging life, and promoting the health through the organized effort and informed choices of society, organizations, public and private communities, and individuals, as it is listed far by CEO Winslow. What are the public health challenges of today? I would like, as all of you know, share some of the challenges that we face. These are emerging diseases, re-emerging diseases, food safety, natural disasters, obesity. We have an aging population with health disparities across the globe, global warming, bioterrorism, drug abuse, and violence, among many others. So what is the public health approach? As you will know, and looking to the slide, we start with surveillance, which is basically what is the problem. Then we'll follow with risk factor identification, which is what's the cause, maybe. And then intervention and evaluation, what works. And at the end will be the implementation, how do we do it? And based on this, the public health has three core functions. And the core function of public health are assessment, policy development, and assurance. So as you can see from the slide, assessment is systemically collect, analyze, and make available information on health community. Policy development, it promotes the use of this scientific knowledge based on policy and decision making. And at the end, the assurance is ensure the provision of service to those in need. In addition, there is a 10 essential function of public health, and if you are following the trend in the past, the center of it was about research, but as you can see right now, that's changed last year, and the center of the core function now is equity. So what about the public health education in the United States? So for public health education in the United States, it evolved along all of the most pressing world challenges. Students in public health can tap into a very rich information and training with different concentrations and academic programs. So the graduate of the CEF accredited, which is the Council on Education on Public Health, from the different schools and the program that are accredited, are equipped to deal with the most pressing population health skill to address the most challenging issues worldwide. So public health professionals will focus on preventing disease and injury by promoting healthy lifestyles. They implement educational programs, develop policies, administer services, conduct research, and regulate health system to achieve all of these goals. So what is CEF accreditation? As I said, CEF is the Council on Education on Public Health, and it is a nationally recognized accrediting body within the United States, and many of the international schools and programs now selected to be accredited by CEF as well. So the CEF accredited schools and program of public health will provide a variety of degrees in public health, including undergraduate, master, certificate, as well as doctorate program in a number of different areas of study. Each CEF accredited school or program goes through a very rigorous accreditation process on a regular basis, like every 7 years, to assure students the quality of the education and training they are receiving. Many CEF accredited school and program of public health offer online programs, dual degree program, and executive programs as well. And because CIF accredited schools and programs in public health are peer reviewed, students can be sure that the institution that they are studying in it will meet the standard established by CIF. So for the undergraduate degree in public health in the United States, we can have major or in different areas. For CIF accredited, they actually require to address 11 different issues that has to be included in every curriculum. And for the undergraduate education in public health in the United States that follow the CIF accreditation, the curriculum should include these following items related to like basic statistics, biological and life sciences, the history and philosophy of public health data collection, use and analysis of data, population health concept, the underlying science of human health and disease, along with health disparity, project planning, evaluation and implementation, organizational structure of the healthcare in the United States and comparative to other health systems worldwide, legal, ethical, economic and regulatory dimension, and of course communication in the different media, writing and social media as well as technology. As for the graduate degree and with the Master of Public Health for CIF accredited, again there are foundational learning objectives, and there are 12 of them on the slide. And I will not go through all of them, but a quick example is explain public health history at the level, identify the 10 essential functions, explain the role of quantitative and qualitative method, and discuss the science of primary, secondary, and tertiary prevention, the effect of environmental factor on environment, behavior and psychological effect that affect population health, that explain how globalization also affects the global burden of disease, and the ecological perspective of the interconnection among human health, animal health, and ecosystem, example like One Health. And I will be leaving the slide that can be shared if you really need more on the details. And all of the details are also available on the CIF website for your information. And now I would like to share with you what we are doing for public health education at the University of Arizona within our own college. So as you can see, this is our beautiful building, and our focus is always on educating the next generation of globally minded public health professionals. So first, let me tell you where is Arizona. This is a map of the United States. As you can see in red is where Arizona is. And if you focus on this red arrow, this is where you see what Tucson is, which is in the southeastern part of the state. And you can see we have great, beautiful scenery in Arizona. Welcome you to come and visit. So our mission and our vision are always posted on our website. So it's the focus on it is the health and wellness, health promotion, both at the individual and at the community level. And our focus is both locally, nationally, and globally, as it is reflected in our vision of local impact, national influence, and global reach. And we are proud of our core value that welcome you to reach on our website. So what about our educational programs? We'll start with our undergraduate program, and this is one of our students. And we also are proud on saying that we change the word one community at a time. So for our undergraduate degree, we do actually have several offerings. One of them is the BSPH. This is a Bachelor of Science in Public Health, and it follows the CIF accreditation and provides the student with the opportunity to specialize in one of 7 areas in their senior year, so they gain more expertise. And these include global health, health behavior, health promotion, environmental health, global One Health, can read them all. But also in addition, we do offer undergraduate certificate, and these provide the student another area of focusing regardless what their major is, regardless what their bachelor degree in. And we offer currently 2 of those, an undergraduate in One Health and an undergraduate certificate in global health. Each one is 12 units or 12 credit, that's 4 courses. And also we are in the process of offering next year a new undergraduate certificate in emerging preparedness that is very timely for what we are facing right now with the pandemic. Our other degree that we offer at the bachelor level is a BA in Wellness and Health Promotion Practice. This degree I just started in the spring, and it focuses the student concentration in 3 areas. One of them is health and wellness, the other one is in healthy aging and aging for population health, and the third one is health education. And the student get an opportunity to work within the communities because this is an experiential learning degree in which the students spend some of their time in the classroom and part of their curriculum actually working in communities and in projects related to their own concentration. In addition, within the American system, we have what is called minors. And minors is around 18 units, that's around 6 courses of 3 credit or 3 units each. And it allows, again, the same concept as the certificate, but it allows students within the same university, again, to have another focus in one area. And for us, we offer, as you can see, 7 areas. We have almost 400, 500 students in our minors right now from the University of Arizona. And these areas are public health, global health, One Health, aging, data for population health, environmental occupational health, and our newest one, the wellness and health promotion practice. We also, for our undergraduate and graduate students, we offer summer program or short program because they are either in the summer or in the spring, depending on our partner universities. And one of them is focused on research. This is around a 4-week program. Students get matched with a mentor. They work on a research project, and it has students from around the world coming to Arizona for 4 weeks. And the other one is actually a 2-week program, and it is much more of a community engaged where students get introduced to the healthcare system, to different projects, and also they attend and audit some of the classroom and do a presentation at the end. For our graduate degrees, we do offer degrees from a Master of Public Health, a professional degree, an MPH. We do offer a MS Science, which is a Master of Science in one of the area of public health. We offer DRPH, which is a Doctor of Public Health, as well as PhD, which is the academic or Doctor of Philosophy in Public Health. And as you can see, we have 13 areas of study. Some of them offer all of the level, MPH, Master and PhDs, and some will only focus on one area or the others. So for our Master of Public Health, as I explained earlier, all of the students have to have the competencies as set by CEEP, the accreditation body, and then they will specialize in one of these 11 areas that we have, and each area of specialization has its own additional 5 competencies that also have to meet the CEEP accreditation guideline and criteria within the United States. We do offer online graduate certificate, and the good thing about the graduate certificate, they provide a core knowledge for specialization in one of the areas. And if the student decided to join an MPH program, all of the units or the credit they have taken, then they can use toward their MPH degree if they decided to pursue further education. But otherwise, it's like a postgraduate diploma, which allow them a high specialization and training in their area of choice. In addition, as I said, we have PhD programs. We do have 4 of them in biostatistics, in environmental health, epidemiology, health behavior, health promotion, as well as we have 2 professional doctorate degrees, which we call DRPH, or Doctor of Public Health, and we have them in policy management as well in maternal and child health. So for any opportunity to share with you before we close for conclusion, for international student, scholar, or research, there is many different areas of potential collaboration at the bachelor level, the certificate, the MPH, and even at the internship or summer program or study abroad. So I'm looking forward to working with you all to improve the lives and health of all the people in our respective nation and around the world. Our health largely depends on conditions where we live, we learn, we work, and play, and not just on the medical treatment we receive. Thank you, and we invite you to a very quick short tour of our programs and college at the University of Arizona. Have a great day.
The Zuckerman College of Public Health, located on the University of Arizona Health Sciences campus in Tucson, Arizona, offers an exceptional location for a public health education. State-of-the-art facilities include modern classrooms, laboratory spaces for teaching and research, and a range of indoor and outdoor spaces for meetings and events. When you come to the Zuckerman College of Public Health, you join a diverse community of passionate students and faculty dedicated to improving the health and wellness of people in Arizona and around the world. Come experience the power of public health.